Hi everyone, how are you? Welcome to another question and answer session. This is the physiology portion. During pneumonectomy for carcinoma of the bronchus, there is injury to pulmonary vein and blood loss approximately 1750 ml, which is the larger amount, and which type of change will not occur in this condition. That means when blood loss, there is definitive changes in our body, but in this question they want to know about the which will not occur. That means which is false regarding this condition. Here the options are decrease cardiac output, increase heart rate, reduce left ventricular filling pressure, reduce blood pressure, and reduce systemic vascular resistance. So when there is reduced hemorrhage, that means the reduced blood volume, then blood pressure decreases. So first of all, here we can see the arterial blood pressure which will reduce. When arterial blood pressure reduce, then from the renal system, aldosterone, angiotensin to aldosterone, this will be increased secretion for the replenish the volume, and they increase absorption of sodium chloride and water from the kidney tubule. On the other hand, the angiotensin 2, it also increase thirst and water intake, and finally the plasma volume will increase a little bit and try to stabilize the blood pressure. So immediately when a hemorrhage occurs, then first of all blood volume it will decrease, blood pressure it also decrease, so blood reaching to the heart for circulation it also reduce. But we need more blood for this condition. The blood vessel it will reduce its diameter for give more blood, because when there is larger diameter, then in the blood vessel there is certain amount of blood, but when the diameter reduce, then most of the blood goes to the heart. For this condition, the blood vessel diameter will reduce. So in case of hypovolemic shock, here we can see the cause such as the hemorrhage, vomiting, diarrhea, dehydration, and third space loss. And in this condition, what is increase heart rate to compensate the oxygen delivery, increase systemic vascular resistance. That means the diameter of the vessel will reduce. So diameter of the vessel will reduce and vascular resistance will increase, and decrease cardiac output. As there is less blood, so cardiac output will be decreased. Decrease blood pressure. There is no blood or reduce blood, so reduce blood pressure. So what will happen? Decrease cardiac output. It is true because there is less amount of blood as bleeding occurs. Increase heart rate. It is true because the heart rate increase to compensate the less amount of blood and circulates the small amount of blood repeatedly. Reduced left ventricular filling pressure by the blood. So when blood reduce, filling pressure reduce, and reduced blood pressure, it is also true. But reduced systemic vascular resistance, it is not true, because systemic vascular resistance increase by reducing the blood vessel diameter. Thank you all.